One of the proposals in the recommendations in that proposal is that all Utahns be required to have health insurance of some sort, and those who are not able to afford it would be paid for by the state through one of the state's health programs. It's a mandate of health insurance. Are you comfortable with that, with requiring every Utahn to get health insurance?
I'm comfortable with a requirement. You can call it whatever you want, but at some point we're going to have to get serious about how we deal with this issue. And that means there will have to be a multitude of different policies that are available in the marketplace. It means that it will be incumbent upon citizens to look more at responsibility, their own responsibility in terms of health and the choices that are made. It likely will mean that we'll be in an environment with better prices, more options, more access and availability. There is a mandate today, let us not forget, and it's called the emergency room. And you show up at the emergency room and you get covered. And who pays the bills? You know, taxpayers pay the bills. Companies pay the bills. So we're living today in an environment, to be sure, where there already is a mandate in place. It's whether you want to really make the system more efficient in a world where you've got to figure that 50%, maybe more than 50% of the procedures that are used today are maybe unnecessary or superfluous, which infuses a lot of unnecessary costs into the system. We have an opportunity to do something very unique and novel here in covering our population, in squeezing costs out of the system, in harmonizing patient data like has never been done before in the country, which I think serves the health interests of all of our citizens, and in doing something on the overall health responsibility side, which is taking some responsibility for the choices you make and therefore the implications of the choices that you make and incentivizing people accordingly.